versus the person that says, Mr. Trump, President Trump, this is not safe for the people, and I'm not going to approve it, and he fires them, and then the other guy hands out a whole bunch of food and drugs that are unsafe for the public just because he agreed with Trump. That's what he wants to do.
Well, first of all, the FDA basically already does that. I'm just telling you that right now. The FDA is horrible at their jobs, and it's run by the corporations that they regulate.
It is not.
Yes, it is. That is just a fact.
Prove your point. Prove it. Show me evidence.
Look at the FDA commissioners and where they work.
I am a trauma ICU nurse with 15 years. I work with medications all day long. You have no idea what you're talking about, sir.
Please just go and look at the FDA commissioners and where they work for. What they work for.
You made the claim.
And what they will work for in the next 2 years. It'll either be Pfizer, Moderna, or any of those other pharmaceutical companies or food companies. They're a total joke, and they're run as a joke because they basically just appoint the former CEO of their company to work on there, and then they go back to that company. It's the most corrupt thing ever.
Pfizer and Moderna are the only companies?
No, I don't. I think it's...
Then why are you even saying that? That's so stupid.
That was one example.
No, sir, you don't understand how things work. There are so many drugs that do not get past the FDA for approval. There are companies
that don't
work. Excuse me. There are companies that have been trying to get drugs passed by the FDA for decades, and they haven't been able to get past it. You know why? Because they're trying to keep the American public safe. So please do not tell me that there is a problem, because there isn't.
What they're trying to do is allow corporations to get as much money as they can, especially pharmaceutical companies and giant food companies, and that's what they do, right? The FDA is the most corrupt organization probably in the whole executive branch, and it's not even close.
How do you quantify corruption?
You need to look up how long the law is that a drug can have a patent on it before it goes generic, sir, because there's a law, a federal law, that says they can only have a patent for a certain amount of time, and then other companies are allowed to make it generic. So you're so misinformed. You're just like a young kid who has no fucking clue what you're talking about.
What were you saying, Parker?
Yeah, that's okay. You can totally dismiss me because I'm a woman, but it's not going to work.
It's totally ridiculous. That is not why I dismissed you. You didn't even give me a question or a point.
Try and run for from what I just said because you know it's true. That's fine. Go ahead.
I thought you made a good point when you said the patent thing. I think that is actually a good thing. However, I will say that at the same time, the FDA also selectively approves drugs that are specific to benefit specific companies over the other. That is just a fact. Again, if you want to look at who the FDA commissioners are from and where they are, they've all worked for the big corporations, and they'll go back to working for the big corporations.
Bring up your evidence, Nick, because you're wrong.
Sure.
Put your evidence. Bring it up.
Do you want me to look up?
Yeah, go for it. No idea what he's talking about.
Nick, to let you know, I was going to ask you, how do you quantify corruption?
Yeah, I mean, I used it as more of a hyperbole. You can't really quantify it, however, you know it's there, right?
Wait, I need my tinfoil.
So how do you quantify that it's like one of the most? You said it was one of the most. Your whole point was about quantification.
Right, again, that was more...
You conceded on your whole point there.
That was more of hyperbole. Yes, I mean, I'm not going to sit out there and say this amount of this for this metric or whatever. But I am looking up the FDA commissioner.
It's funny because 99.9% of the directors of hospitals used to be doctors that worked in the hospital because they clearly know how the hospital works, and that's why they put them as the directors of the hospital. It's like you're arguing things that are so ridiculous. You have no life experience. You don't know how the medical field works, and you're 21 years old, 22 years old? Give me a break, man.
This is actually from Senator Bernie Sanders.
Oh.
Bernie Sanders page. 9 out of the last 10 FDA commissioners went on to work for pharmaceutical industry or serve on prescription drug companies' board of directors.
And
9 out of 10. So 90% went to go make money off of their role, right? I don't know how you can say that that's a trustworthy organization or crap on someone else for not trusting in that organization. It sounds pretty suspicious for me. And that's from Bernie Sanders, who I don't agree with 100% on most
No,
things.
they're just saying that there's like an influence. That's not
Yeah,
like
but
an
what?
argument to say
Yeah,
that like that's not an argument to say that like the entirety of the industry as it relates to like scientists and professionals, right, would be something that you wouldn't want to trust.
Right, but the commissioners that decide which drugs are allowed to go through are those. I don't know how many people are
So
on
you're
the board,
saying like the
but that
regulatory
group of people.
so what you're saying is they break the regulations to pass drugs because they're friends?
The regulations are built exactly for what the corporations want, because again, Congress just does whatever the big pharma wants them
that doesn't
to.
mean that all regulations are meant to work that way. I would advocate for
I
universal healthcare. If you
understand,
don't want them to
yes.
do what big pharma does, would you advocate for universal healthcare?
Can you say that again?
I advocate for universal healthcare, Medicare for all. Do you advocate for that? Because that would remove the power of big pharma.
You know, I'm just not well versed on that topic. I would be
What's your
open to
solution
your
for big
arguments
pharma?
for that.
Having
What?
control. What's your solution for big pharma having control?
I mean, I think you take money out of politics. 100%.
I agree with that, but that doesn't fix the issue.
And I think that you ban bureaucrats from going to work for these corporations after they work
I think
in their role.
you engage in universal healthcare, so it's not based upon.
Again, I don't
profit.
know. I'm not going to sit there and advocate for universal healthcare. Can you explain
When
to me
it's
why
half as much
universal
in terms of-
healthcare would help?
Yeah, per capita costs are half as much for countries that have universal healthcare who are industrialized in Europe. Half as much per capita, and they have better health outcomes. Right? So Medicare for all, by a Yale study, would save us $450 billion a year, $4.5 trillion over 10 years. Right? And save 45,000 to 68,000 American lives because they had a lack of health insurance. It also engages in preventive care, right? Make sure that everyone is taken care of, right? Do you not care about that?
No,
So
I
you
do care about
security?
that. You're acting like I disagree with universal healthcare. I just don't know enough about it to be able to really have an opinion on it. It's a very complicated topic.
What do you need to know about it?
I was asking you.
Yeah, but like what else would you need clarification on?
I mean, I guess I would need to look at the benefits and downsides of it, 100%, because there's obviously a counter argument to what you're saying. So but I don't have that in front of me. I'm not even sure I would agree with it.
People
However,
say wait times. This is the only response I hear, right? Which wait times are very bad here in the United States. One, two. As it relates to wait times, you're not taking into account how many people are not able to get access to these particular services because they have to wait in order to pay for it. Right? Or they don't have the money, so they don't even want to go to the doctor's office in the first place, so things might get worse in the long run because they didn't engage in preventative care.
yeah, I mean, I can't really say anything for or against that. That's definitely a counterpoint. I think there's probably more, though. I mean, I think probably the fiscal side of it, the entitlement aspect of it is probably an argument that a lot of people would
It's
say.
overall less costly.
Okay, well, there you go. I mean, I just don't know enough to be able to argue against you on that. So I'm not going to sit here and attempt to because just wouldn't be right. But I am saying, if we're talking about, I mean, sure, maybe universal healthcare stops big pharma. However, I also know that preventing those bureaucrats from working in those jobs after would go a long way as well as a president that